Hello class, this is Emergency Care and Transportation of the Sick and Injured, Chapter 7, Lifespan Development. In this chapter and through the related coursework, you will have a fundamental understanding of the physiological and psychosocial differences of each phase of human development. You will also be able to discuss adaptations and strategies that might apply to better assess and manage patients. Humans develop throughout their entire lives. You have newborns and infants, toddlers and preschoolers, school-age children, adolescents, and then 3 stages of adulthood that are adulthood, early adulthood, middle adulthood, and older adulthood. EMTs must be aware of the physical changes a person undergoes at various stages of life, as they may alter the approach to patient care. Neonates and infants are aged 1 month to 1 year and develop at an extremely rapid rate. Neonates, or birth to 1 month, are covered in Chapter 33, Obstetrics and Neonatal Care. The leading cause of death for this age group is congenital abnormalities, according to the Centers for Disease Control and Prevention. At birth, the pulse rate is 90 to 180 beats per minute, and respiratory rate is 30 to 60 breaths per minute. And this is normal. Shortly after birth, the pulse often drops to 120 beats per minute, and the respiratory rate falls to between 30 to 40 breaths per minute. By 1 year, the respiratory rate slows to 20 to 30 breaths a minute. Blood pressure directly corresponds to the patient's weight, so it typically increases with age. The average systolic blood pressure is 50 to 70 milligrams of mercury for a neonate and 70 to 95 milligrams of mercury for a 1-year-old. Weight plays a factor, and a neonate usually weighs 6 to 8 pounds at birth. The head accounts for 25% of its body weight. After week 2, infants grow at a rate of about 1 ounce a day, doubling their weight by 4 to 6 months and tripling it by the end of the first year. With the circulatory system at birth, the neonate makes the transition from fetal to independent circulation. With the pulmonary system, infants younger than 6 months are particularly prone to nasal congestion. The rib cage is less rigid and the ribs sit horizontally. This explains heavy diaphragmatic breathing in infants. Infants also have proportionately larger tongues and proportionally shorter and more narrow airways. Airway obstruction is more common in infants than older children or adults. For bag mask ventilation, remember that an infant's lungs are fragile. Too forceful ventilations can result in trauma from pressure or barotrauma. Respiratory problems can quickly become life-threatening, so infants who are struggling to breathe can quickly tire, become overheated, and even become dehydrated. As far as the nervous system is concerned, the nervous system's evolution continues after birth. A neonate is born with certain reflexes. Moro reflex, or a startle reflex, is when a neonate is caught off guard and it opens its arms wide, spreads its fingers, and seems to grab at things. The palmar grasp occurs when an object is placed into the neonate's palm. The rooting reflex is when something touches a neonate's cheek, it will turn its head toward the touch. And the sucking reflex occurs when the neonate's lips are stroked. A neonate's fontanelles, or openings in the skull, allow the head to be molded, and these spaces between the bones will eventually fuse to form the skull. The posterior fontanelle fuses by 3 months. The anterior fontanelle fuses between 9 and 18 months of age. If either of the fontanelles is depressed, the infant is most likely dehydrated. A bulging fontanelle is indicative of increased intracranial pressure. An infant's immune system maintains some of the mother's immunities, but infants can also receive antibodies via breastfeeding, further bolstering their immune system. This is an example of the fontanelles in neonates and infants. Psychosocial changes begin at birth and evolve as the infant interacts with and reacts to the environment. With infants, crying is the main method of communicating distress, and parents often recognize just by the tone of the cry what kind of distress their infant is in. Infants develop strong social bonds with their parents and caregivers at different rates. Bonding is based on a close personal relationship and based on secure attachment. Anxious avoidant attachment is found in infants who are repeatedly rejected. Children show little emotional response to their parents or caregivers and treat them as they would strangers when there's anxious avoidant attachment. Separation anxiety is common in older infants. It involves clingy behavior and fear of unfamiliar places and people. Trust and mistrust refers to a stage of development from birth to about 18 months, which involves an infant's needs being met by his or her parents or caregivers. If the environment is not perceived as secure by the infant, a sense of mistrust will develop. Now let's move on to toddlers and preschoolers. Toddlers are ages 1 to 3 years. Their pulse rate is normally 90 to 150 beats per minute, and the respiratory rate is generally 20 to 30 breaths per minute. Their systolic pressure is 80 to 100 milligrams of mercury, and their average temperature is 96.8 degrees Fahrenheit. A toddler's lungs will continue to develop more terminal bronchioles and alveoli. With preschoolers, these are ages 3 to 6 years, the pulse rate is 80 to 140 beats per minute, respiratory rate is 20 to 25 breaths per minute. The systolic blood pressure is 80 to 100 milligrams of mercury. With preschoolers, weight gain should level off. Although toddlers and preschoolers have more lung tissue, they do not have well-developed lung musculature. This prevents them from sustaining deep or rapid respirations for an extended period of time. The loss of passive immunity is possibly the most obvious development at this stage of human life. Colds often develop that may manifest as gastrointestinal distress or upper respiratory tract infections. Toddlers acquire immunity as their bodies are exposed to various viruses and germs. Neuromuscular growth also makes considerable progress at this age. Toddlers and preschoolers spend time exploring by walking, running, jumping, and playing catch. Preschoolers will have a brain that weighs 90% of its final adult weight, and the muscle mass and bone density continue to increase. Psychologically, toddlers have the neuromuscular control capable for bladder control by 12 to 15 months of age. However, the child may not be psychologically ready until 18 to 30 months of age. The average age for completion of toilet training is 28 months of age. The leading cause of death for this age group is unintentional injuries or accidents. With psychosocial changes in toddlers and preschoolers, you have toddlers or preschoolers that learn to speak and express themselves, and at 36 months of age, basic language is mastered. Interaction and playing games with other children begins, and by 18 to 24 months, cause and effect begin to become understood. Children learn to recognize gender differences by observing role models. School-age children are considered 6 to 12 years, and a school-age child's vital signs and body gradually approach those observed in adulthood. The pulse rate is approximately 70 to 120 beats per minute, respiratory rate is 15 to 20 breaths per minute, and their blood pressure is 80 to 110 milligrams of mercury. Obvious physical traits and body functions become apparent. There's a growth of 4 pounds and 2.5 inches each year. Permanent teeth start to come in. Brain activity increases in both hemispheres. Unintentional injuries are the leading cause of death in this age group as well. The psychosocial changes that can occur at this age are that children learn various types of reasoning. Pre-conventional reasoning is developed where children act almost purely to avoid punishment and get what they want. Also developed is conventional reasoning, where children look for approval from their peers in society, and post-conventional reasoning, where children make decisions guided by their conscience. Children begin to develop their self-concept and self-esteem. Self-concept is our perception of ourselves, and self-esteem is how we feel about others and how we quote-unquote fit in with our peers. Adolescents tend to range between 12 to 18 years, and vital signs begin to level off with the adult range, where the pulse rate is 60 to 100 beats per minute typically, respiratory rate is 12 to 20 breaths per minute, and systolic blood pressure is between 90 and 110 milligrams of mercury. Adolescents experience a 2 to 3 year growth spurt, which is an increase in muscle bone growth and body changes. Growth begins with hands and feet, then moves to the long bones of the extremities, and finishes with growth of the torso. Girls generally finish their growth spurt by 16 years and boys by 18 years. When this growth spurt finishes, boys are generally taller and stronger than girls, and muscle mass and bone density are nearly at adult levels. The reproductive system begins to mature, and first secondary sexual development takes place, where the external sex organs enlarge, pubic hair and axillary hair begin to appear, voices start to change. In girls, the breasts and thighs increase in size as fat tissue is deposited there, and menstruation begins. By the middle of adolescence, boys are able to produce sperm, and girls begin to produce eggs, and acne can also occur due to hormonal changes. Unintentional injuries are the leading cause of death for adolescents. With psychosocial changes in adolescence, adolescents and their families often deal with conflict as adolescents try to gain control of their lives from their parents. Privacy becomes an issue and self-consciousness increases. Adolescents may struggle to create their own identity. Antisocial behavior can also begin to appear and peak at 14 to 16 years. They often want to be treated like adults, yet cared for like younger children. With antisocial behavior between 14 to 16 years, smoking, illicit drug use, and unprotected sex are problems that may arise. There can also be a problem with eating disorders from an attempt to gain self-control through what they eat. Adolescents show a greater interest in sexual relations. A code of personal ethics developed, based partly on parents' ethics and values, and partly on the influence of the adolescent's environment. Many adolescents are fixated on their public image and are terrified of being embarrassed. Adolescents are at higher risk than other populations for suicide and depression. Early adults range from 19 to 40 years. Their vital signs do not vary greatly from those seen throughout adulthood. The pulse rate will average around 70 beats per minute and range between 60 to 100 beats per minute. Respiratory rate will stay in the range of 12 to 20 breaths per minute, and systolic blood pressure will be between 90 and 140 milligrams of mercury. From age 19 to shortly after 25 years, the body should be functioning at its optimal level. Lifelong habits are solidified. The body's working at peak efficiency, but as early adulthood continues, subtle erosion begins. Discs in the spine begin to settle, and height sometimes shrinks. Fatty tissue and weight can increase, and muscle strength decreases and reflexes slow. With psychosocial changes, life centers on work, family, and stress. During this period, adults strive to create a place for themselves in the world and may do everything they can to quote-unquote settle down. Along with this usually comes marriage and family. Despite all this stress and change, this is usually one of the most stable periods of life. Middle adults range 41 to 60 years. As far as physical changes, the vital signs remain the same. Average pulse rate remains around 70 beats per minute with a range between 60 and 100 beats per minute. Respiratory rate continues at 12 to 20 breaths per minute, and blood pressure remains between 90 and 140 milligrams of mercury. Middle adults become vulnerable to vision and hearing loss. Cardiovascular health can become an issue. Cancer incidence also increases. Menopause takes place in late 40s or early 50s, typically. Diabetes, hypertension, and weight problems are common. Exercise and a healthy diet can diminish some of the effects of aging. Unintentional injuries are the leading cause of death in ages 41 to 44 years. However, cancer is the leading cause of death in ages 45 to 60 years. With psychosocial changes, the focus is on achieving life goals. Middle adults must readjust their lifestyle as children leave home. Finances can become a worrisome issue. And generally, people of this age have the physical, emotional, and spiritual reserves to handle life's issues. Middle adults may find themselves caring for children, leaving for college, and caring for their aging parents as well. Older adults include those ages 61 years and up. With physical life, it changes. Life expectancy is constantly changing. So in the early 1900s, life expectancy was 47 years, but it is now approximately 78 years. The age to which a person will live is based on many factors, including year of birth and country in which the person lives, public health advances, changes within diets, attitudes regarding exercise, and advances in and access to medical care and personal behaviors. Cancer is the leading cause of death ages 61 to 65 years, while heart disease is the leading cause of death ages 65 and older. Vital signs depend on the patient's overall health, medical conditions, and medications taken. Older adults are often able to overcome numerous medical problems but may need multiple medications. With the cardiovascular system, cardiac function declines with age, largely due to atherosclerosis. Cholesterol and calcium build up inside the walls of blood vessels, forming plaque. Accumulation of plaque eventually leads to partial or complete blockage of blood flow. More than 60% of people older than 65 years have atherosclerotic disease. Heart rate and cardiac output decrease, and cardiac output can no longer meet the demands of the body. The vascular system starts to become stiffer, and diastolic blood pressure will increase with age. The heart must work harder to move blood effectively. The ability to produce replacement blood cells declines, as does the blood volume. With the respiratory system, the size of the airway increases and the surface area of the alveoli decreases. The natural elasticity of the lungs also decreases. Intercostal muscles are used more to breathe, and breathing becomes more labor intensive. Within the mouth and nose, there is a gradual loss of the mechanisms that protect the upper airway. This leads to a decreased ability to clear secretions, as well as decreased cough and gag reflexes. Aspiration and obstruction become more likely. As the smooth muscles of the lower airway weaken with age, strong inhalation can make the walls of the airway collapse inward and cause inspiratory wheezing. The cells of the immune system are also less functional. By age 75 years, the vital capacity may amount to only 50% of the vital capacity of a young adult. Factors include loss of respiratory muscle mass, increased stiffness of the thoracic cage, decreased surface area available for the exchange of air, and then residual volume increases with age. So a lifetime of breathing, especially breathing air with high levels of pollution, causes the accumulation of pollutants in the lungs. In older adults, there are changes in the endocrine system as well. Insulin production drops off and metabolism decreases. People tend to slow down their physical activity, but they tend not to decrease their food intake. The pancreas may not be able to produce enough insulin for the person's body size, which can lead to diabetes mellitus. The reproductive system also changes to some extent. Men are able to produce sperm long into their 80s, but the rigidity of the penis tends to decrease over time. Women have a decrease in the size of their uterus and vagina. Hormone production for both sexes gradually decreases as they age. Sexual desire may diminish with age, but does not cease. In older adults, the digestive system produces changes in gastric and intestinal function and may inhibit nutritional intake and utilization in older adults. Taste sensations decrease. Saliva secretion decreases, and this reduces the body's ability to process complex carbohydrates. The ability of the intestines to contract and move food diminishes, and gastric acid secretion diminishes. Gallstones become increasingly common, and anal sphincter changes may produce fecal incontinence. With the renal system, the filtration system of the renal system declines by 50% from ages 20 to 90 years. Kidney mass decreases 20% over the same span, due in part to the decreased effectiveness of the blood vessels that supply blood to the nephrons inside the kidneys. There is a decreased ability to clear waste from the body and a decreased ability to conserve fluids when needed. Nervous system. In the central nervous system, the brain weight may shrink 10 to 20% by age 80 years. Motor and sensory neural networks become slower. Neurons are lost, but there is not a loss of knowledge or skill. Sleep patterns change in older adults. Here's a slide that shows age-related shrinkage of the brain, and this creates a void between the brain and outermost layer of the meninges. Peripheral nerve sensation is diminished, so increased reaction times cause longer delays between stimulation and motion. The resulting slowdown in reflexes and decreased kinesthetic sense may contribute to the incidence of falls and trauma. There are sensory changes as well. Most older adults can see and hear well. They may need glasses or hearing aids, but it's wrong to assume that older patients are blind or deaf. Visual distortions are common, and hearing loss is 4 times more common than vision loss. With psychosocial changes in the elderly, until about 5 years before death, most people retain high brain function. In the 5 years preceding death, mental function is presumed to decline, which is a theory referred to as the terminal drop hypothesis. And as it is a hypothesis, it is yet totally proven. It is yet unproven, and is certainly not the case in every elderly person. As the elderly population continues to grow, we have the responsibility to accommodate their needs during the last 20 to 40 years of life. Statistics indicate that 95% of the elderly live at home. The increasing number of elderly in the United States as a result of the baby boom of the 1940s to 1960s has produced a need for additional assisted living facilities, but financial limits may restrict access to health care or medications. Today, more than 50% of all single women in the United States who are 60 years of age or older are living at or below the poverty level. One of the important issues the elderly need to face too is their own mortality. So isolation and depression can be challenges. Okay, class, thank you for your attention to this, and let's go over some review questions. Question 1. When providing bag mask ventilations to an infant, what is most important to remember? A. Blood pressure typically increases with age. B. An infant's lungs are fragile. C. An infant grows at a rate of 30 grams per day. And D. An infant has a proportionally larger tongue than an adult. If you just stop and think, the logical answer should be easy and straightforward. It is, of course, B. It's important to remember that an infant's lungs are fragile, and ventilations that are too forceful can result in trauma from the pressure or barotrauma. Due to the large size of the infant's occiput and the increased flexibility of the trachea, the airway can easily be inadvertently occluded by incorrect positioning, either overextension or overflexion. So let's look at why the other answers were wrong. A. Blood pressure typically increases with age. That doesn't have anything to do with bag mask ventilations to an infant. B, of course, is the correct answer, which is an infant's lungs are fragile. C, an infant grows at a rate of about 30 grams a day. Again, this is not crucial information when giving ventilations. And D, an infant has a proportionally larger tongue than an adult. While this may be true, a larger tongue could occlude the airway, but it's more important to remember the fragility of the lungs themselves. Question 2. You see an infant capable of reaching out to people and drooling. She is most likely 2 months of age, 3 months of age, 4 months of age, or 5 months of age. And the answer is C. An infant's psychosocial development begins at birth and continues to evolve as the infant interacts with and reacts to the environment. At 4 months of age, an infant is likely to start reaching out to people and drooling. So we see the other answers that are incorrect. A, 2 months of age. The psychosocial development at this age involves recognizing familiar faces only. At 3 months of age, the psychosocial development involves bringing objects to the mouth. And anyone who's been around small children knows this. They tend to put everything in their mouths. Age 4 months is the correct answer. And age 5 months, psychosocial development involves sleeping finally through the night. So here the correct answer is 4 months of age. Question 3. An infant who's repeatedly rejected experiences what type of attachment? Secure attachment, anxious avoidant attachment, trust and mistrust, or rejection attachment? If you think back to the correct term that I used, you'll get this one right. It is B. Anxious avoidant attachment is observed in infants who are repeatedly rejected. In this attachment style, children show little emotional response to their parents or caregivers and treat them as they would strangers. These children develop an isolated lifestyle where they do not have to depend on the support and care of others. So let's look at the other answers and see why they're incorrect. Secure attachment is the antithesis of what we were just talking about. Secure attachment occurs when an infant understands that parents and caregivers will be responsive to his or her needs. Anxious avoidant attachment is, of course, the correct answer. Trust and mistrust. An infant's needs are met by his or her parents or caregivers. So it's not a trust and mistrust issue as much as it is just they don't think anybody's going to provide for them at all. And rejection attachment is not a real type of classified medical attachment. Question 4. Why do colds develop so easily in toddlers and preschoolers? A, they experience a loss of passive immunity. B, they do not have well-developed lung musculature. C, they are spending a lot of time around playmates and classmates. Or D, all of the above. Let's look at the correct answer. It is D, all of the above. All of these choices contribute to a toddler or preschool's increased likelihood of contracting a cold or anything else. So at this point in their life, their immune system is still developing, and it is considered a childhood natural course to have colds and things like that fairly commonly until their immune system is fully mature. So since the answer was all of the above, I'm not going to review A, B, C, because we know D is the correct answer. And as we see here on this slide, D is the correct answer. Number 5, the pulse rate of a toddler is 80 to 140 beats per minute, 90 to 150 beats per minute, 90 to 180 beats per minute, or 100 to 160 beats per minute. Remember, this is a toddler, age 2 to 3 years. And the correct answer is B. A toddler's pulse rate is generally 90 to 150 beats per minute. Let's look at the other answers here. A, 80 to 140 beats per minute. The pulse rate of a preschool age child is 80 to 140 beats per minute. 90 to 150 beats per minute is the correct answer. 90 to 180 beats per minute, and the pulse rate of a neonate is 90 to 180 beats per minute. And 100 to 160 beats per minute is the pulse rate of an infant, and that's 100 to 160 beats per minute. Question 6. A school-age child looking for approval from his peers and society is demonstrating what kind of reasoning? Pre-conventional reasoning, conventional reasoning, post-conventional reasoning, or trust and mistrust? If you think back or do a quick back on your notes, you'll get this one correct. And that is B. During school-age development, children begin to develop their self-concept and self-esteem. It is a critical time in human development. Children who look for approval from their peers and society are demonstrating conventional reasoning. Let's look at the other answers. A. Pre-conventional reasoning means that children act almost purely to avoid punishment and to get what they want, whereas conventional reasoning is when they're looking for approval from peers and society. Answer C is post-conventional reasoning, and this is where children make decisions guided by their conscience. And trust and mistrust refers to a stage of infant development, not school-age development. Question 7. Self-concept is a perception of ourselves, how we feel about ourselves, C, how we fit in with peers, or D, how we react to certain situations. Everyone should get this one right. So let's see what the answer is. It is A. Self-concept is how we perceive ourselves. So let's look at the other answers. A is self-concept is how we perceive ourselves. B, how we feel about ourselves. That's actually an example of self-esteem. So our perception of ourselves is our self-concept versus our self-esteem, which is how we feel about ourselves. C is how we fit in with peers, and that's an example of self-esteem, and how I feel about others, and this is an example of how we perceive others. Question 8. Why should you be concerned about a 16-year-old patient who seems depressed? A, she could be exhibiting rebellious behavior. B, she's just finished her growth spurt and may be disappointed in the results. C, adolescents are at higher risk for suicide. Or D, she may be having unprotected sex. If you know the statistics, which are pretty commonly out there, you should get this one right. The answer is C. Adolescents are struggling to create their own identity but are caught between two worlds. They want to be treated like adults but want to be cared for like younger children. Many adolescents are fixated on their public image and are terrified of being embarrassed. Because of all these factors, adolescents are at a higher risk than other populations for suicide and depression. Let's look at the other answers. A, she could be exhibiting rebellious behavior. Someone who seems depressed isn't rebellious typically. An adolescent may exhibit rebellious behavior to try and find his or her own identity, but is not a cause for concern. B says she's just finished her growth spurt and may be disappointed in the results. While girls finish their growth spurt around 16 years of age, it doesn't generally cause depression, and it doesn't always finish at 16. Sometimes it doesn't finish until your early 20s. So there's a little room for play in there, emotionally speaking and critically thinking wise. C, adolescents are at adult for higher rate of suicide. We already discussed that, and that is the correct answer. Or D, she may be having unprotected sex. Peer pressure among adolescents could cause rebellious behavior, but depression is not proof of such activity. Question 9. Why do finances become an issue during middle adulthood? A, middle adults are often supporting both their children and their parents. B, middle adults make less money than early adults. C, their deteriorating health makes it difficult to get work. Or D, hearing loss prevents them from working. If you're familiar with typical headlines for today, and if you paid attention to what I talked about earlier, you'll definitely get this one right. And the answer is A. The parents of adults in this age group are getting older and now need care. Most of the elderly in the United States are cared for by family members inside the home. Therefore, a person in middle adulthood may need to manage children who are leaving for college while at the same time caring for their parents who require greater assistance. Let's look at why the other answers are wrong. B, middle adults make less money than early adults. There's no evidence to support that statement. C, their deteriorating health makes it difficult to get work. Generally, health is stable during middle adulthood, and crisis is viewed as a challenge to be overcome. And D, hearing loss prevents them from working. Middle adults are vulnerable to hearing loss, but this certainly doesn't stop them from excelling in the workplace. 10. Why is breathing more labor-intensive for the elderly? A, the size of the airway increases and the surface area of the alveoli decreases. B, the natural elasticity of the lung decreases. D, the overall strength of the intercostal muscles and diaphragm decreases. Or D, all of the above. This one should be easy. And it is D. All of these factors make breathing more labor-intensive for the elderly. And since I covered this, and D was the correct answer, I'm not going to review each of these. So there's D, which is the correct answer. All of the things A through C contribute to breathing being more labor-intensive for the elderly. Class, thank you for your time and attention here in Chapter 7. Please make sure to read your text thoroughly. If you have any questions, please consult your instructor. Thank you again, and I'll see you next class.